So, what are some of the most common fertility challenges that people face, and how do they know that it's time to see an expert?
Absolutely. So, one of the most common challenges we see is what's called diminished ovarian reserve. And that basically means that, we know that we're born with all the eggs we'll ever have, but we lose them slowly with time. And, when I see somebody in my practice who's maybe like 38, 40, 42, we know that at those ages, usually not just the egg number goes down, but the egg quality gets worse with time. And so trying to help people get to that good egg, right, and really help build their family, that can be a struggle sometimes. So that's one of the hardest problems we treat. A lot of people are, just simply not ovulating. And I always say, your clock is that you guys have been trying for a year and a half. However, if you're never ovulating, then, there's never really been sperm and egg exposure. And so we help people with that too, help them ovulate. But I think one of the other things that people don't realize is that up to 50% of infertility is actually male factor. And so a lot of people poke and prod the female in a heterosexual relationship. But I think it really is important to look at the male side of things if, when appropriate, and on the sooner side, because there's a lot of things that we can find and treat, especially as it pertains to the couple as a whole. And so, to your point about when does it make sense to see a specialist, the recommendation is if you're under the age of 35 with regular sperm exposure, it makes sense to wait a year before seeing somebody like me. If you're 35 or older, because of that diminished ovarian reserve problem we talked about, if you've been trying for 6 months and things are not connecting, then, go.